Okay, so now we're talking about the treatment of anxiety disorders. And so we'll approach treatment from the various psychological theoretical perspectives. So first, using a psychodynamic perspective. So psychodynamic perspective states that anxiety is viewed as coming from external danger and the breakdown of the ego's attempt to satisfy the id without violating the demands of reality and of the superego. And this results in what Freud called neurosis. So he believed then that anxiety builds up as the id impulses move closer to the conscious mind. And the ego tries to defend against this anxiety by displacing it. So Freud's concept then of defense mechanisms helped to keep this anxiety at bay. We might also look at particular disturbances in the parent-child relationship, looking at attachment theory. So remember, attachment is that bond between a child and a caregiver. And children who have anxious attachment to their parents, they experience dependency and insecurity in the parent-child bond. So they may experience some separation anxiety, they may have experienced loss of a parent, or they may have just experienced inadequate parenting. Perhaps there's been severe neglect in the parent-child relationship. And so then the treatment for anxiety disorders, at least in the psychodynamic perspective, is to free associate, to be able to reveal that unconscious material that is causing the anxiety. And then to analyze this resistance, to also reveal this unconscious anxiety or the unconscious conflict that's going on that is causing the anxiety. More modern psychodynamic approaches to treatment move towards briefer face-to-face therapies that are directed more to the present and the specific symptoms, as opposed to trying to explore all of this stuff that potentially has happened long ago in the past. Looking at a behavioral perspective. So behavioral perspective emphasizes learning and how people learn to be anxious. So according to this perspective then, there is classical conditioning that's going on here. So for example, a neutral stimulus is paired with some kind of aversive stimulus. So the individual learns to associate fear with, let's say, spiders in a specific phobia. And then the individual is trying to get away from, they're trying to avoid that stimulus, which actually serves to reinforce their belief that this is something to be scared of. So they get away from the aversive stimulus, they get away from the spider, and that reduces the unpleasant experience of anxiety, right? So they get some kind of reinforcement. The reduction in anxiety related to avoiding that stimulus makes it more likely that the next time they encounter that stimulus, the next time they see a spider, they're going to run in the other direction to get away from that particular stimulus. So that's negative reinforcement in action. So then to treat anxiety, there are a number of different approaches, and these are actually very, very effective in helping a client to unlearn anxiety. So first, we can use something called systematic desensitization. With systematic desensitization, you are basically requiring that the individual move through what's called a hierarchy of fears, and you're pairing the experience of whatever it is that they're scared of with with relaxation. And the idea is that the person cannot simultaneously experience anxiety and relaxation. They cannot happen at the same time. The two responses are incompatible. So what you do then, you have the individual create a hierarchy of fears. So let's say that you're scared of spiders. You might start with something that's not overly anxiety provoking. So let's say, seeing a picture of a spider in a book. Okay, so that might be level 1. And then the next level, you are imagining that you're experiencing a video of a spider. So you're watching a YouTube video of spiders. That's middle ground anxiety. And then at the top of your hierarchy would be, having a spider crawl on your arm. That's like the most anxiety that you could possibly experience. And so you have the client work through this hierarchy, work through this gradation of things that are scary or fearful related to the stimulus, and then you have the client relax while imagining going through this particular hierarchy of fears. You may also choose to use exposure therapy, where you have the client confront the feared stimulus in vivo, so that means in person. You might have the clients imagine that they are being exposed to a spider. You might have the client actually be exposed to a spider. You might use this flooding technique where you expose the client to whatever it is that they're scared of all at once, and you do not allow them to escape. So in the video that I want you to watch, there is a great example of a woman who has a phobia of feathers, and her therapist is using this flooding technique, exposing her to feathers for prolonged periods of time. The difference between exposure therapy and systematic desensitization is that with systematic desensitization, you're pairing it with relaxation. With the other exposure techniques, it does not require that you're also pairing the response with relaxation. It's basically that you're just being exposed to whatever it is that you're scared of for prolonged periods of time. Okay, so a cognitive perspective, looking at the way that you're thinking. So a cognitive perspective says that individuals who experience anxiety misperceive danger. They overestimate danger, and they rely inflexibly on self-defeating ways to deal with fears. They misperceive or misinterpret internal and external stimuli. So, for example, remember when we talked about panic attacks? And individuals who experience panic attacks are very tuned in to what's going on physiologically. They are very in tune with any kinds of slight changes in heart rate, in their breathing. They're very, very tuned into that. And then they misperceive those physiological changes as, oh my God, I'm dying. I need to attend to this right now, as opposed to just interpreting it as normal stress. So to reduce this misperception, you focus on three parts. So first, focusing on changing these interpretations of bodily sensations, focusing on changing how you interpret what's going on internally, suggesting other interpretations such as, okay, this is just stress, it's normal, it's going to pass, and then testing the validity of other interpretations. So help the patient basically test this validity that something else could be going on. So a cognitive behavioral model then could be very useful in helping the client to attack these particular anxieties. So with a cognitive behavioral model, the idea is that your thinking and behavior mutually influence each other. So you have here this model where we have the social situation, the thoughts or beliefs that go along with that situation, including how you interpret an event, the behaviors, so these could be the avoidance behaviors that come along with anxiety, as well as the emotions, right? And oftentimes these emotions are not necessarily rational. They're not logical, but they nonetheless mutually influence each other. A biological perspective looks at the influence of genetics, particularly looking at this concept of temperament, where we see that some individuals are born with a predisposition to be very nervous, to freak out basically when they are exposed to new stimuli. So some babies show what's called a high reaction. They're highly reactive. This means that they become upset when they are exposed to new stimuli in the environment. Some babies are low reactive. They're more easygoing. They don't freak out as much when they are exposed to new situations. And these babies who are highly reactive, who are upset when they are exposed to new stimuli in the environment, are more likely to develop anxiety compared to individuals who do not get as aroused or as upset by new stimuli in the environment. Neurotransmitters, those chemical messengers within your brain, also play a role. So GABA, an inhibitory neurotransmitter, is implicated in anxiety disorders. And then additionally, serotonin. So serotonin, the neurotransmitter related to your mood. Serotonin seems to be involved in things like obsessive compulsive disorder as well as social phobia. So then in terms of treatment, we have a number of different treatments here. Drug treatments for anxiety. You might be prescribed a benzodiazepine, which slows down activity in your central nervous system. Specific examples include Valium and Xanax. You may also be prescribed some antidepressant drugs. So serotonin seems to be involved in the experience of some anxieties, and so using drugs that basically control the amount of serotonin that is released and make serotonin more available in the brain could have an effect on the experience of anxiety. Specific examples include this class of antidepressants called selective serotonin reuptake inhibitors, or SSRIs. Specific clinical examples, or the names of these drugs, prescription drugs, are things like Paxil, Zoloft, or Prozac.